We have a quorum now, so we'll go ahead and start the meeting. We've got three bills to discuss. First one is House Bill 539, Medicaid, provide for presumptive eligibility for pregnant women. And I'm going to recognize Senator Boyd for an explanation of the bill.
Thank you, Mr. Chairman. This bill does not introduce any additional eligibility category or expand coverage. What it simply does is it allows pregnant women to get into a doctor's office quicker. And why this is particularly important is, and it's critically important for our state, is our state's preterm birth rate is the highest in the nation. Our infant and maternal mortality are also the highest in the country. According to all of our leading health experts that we've had testify for over 2 years now, the most critical mechanism to prevent these adverse pregnancy outcomes and risk is to get an adequate early prenatal care. 2/3 of the births in this state are to Medicaid mothers. This bill simply allows these mothers to get to a doctor's office quicker. So what the bill proposes is that a qualified provider, whether it be from the health department, a federally qualified FQHC, a doctor's office who's been trained and approved through Medicaid, would have the ability to presumptively designate a woman eligible for Medicaid when she presents pregnant and presents proof of income, and therefore her allowed to get into the doctor's office earlier while the Division of Medicaid is making that final an official determination that she is eligible. The House, we asked for a physical note on this. Presumptive eligibility would cost the state roughly $560,000. If you compare that to the birth of one child that goes into preterm labor here at UMMC can cost the state upwards of $1 million. You can see that this is a very good cost-saving measure. It will have minimal investment for a tremendous impact for the benefit of the women and the children in the state. So the bill allows pregnant women to receive care and to presume Medicaid eligibility for 60 days after their first doctor's visit. During that time, during that 60-day window, the women can submit their paperwork and they can submit it fully for eligibility to Medicaid. And since a regular Medicaid application takes about 45 days to process, this will help make sure that we're getting women to the doctor faster. So that's the bill, Mr. Chairman. I'll entertain questions.
Thank you. Are there any questions from the committee members? Senator Horn.
Thank you, Mr. Chairman. Senator Boyd, the 60 days, is that when the service commences after a determination is made?
I'm sorry, one more time.
After a determination is made, the 60 days that you're speaking of.
It's presumptive eligibility for 60 days.
For 60 days.
For presumptive eligibility for 60 days.
Okay.
So during that window of time, the doctor's office puts the Office of Medicaid on notice, and then the woman will have the opportunity to make sure she gets her paperwork in and files with Medicaid because there's a 45-day gap there.
Right.
That should cover her during that 45-day
Okay, so
gap.
the presumption is that she will be determined to be eligible
within that 60
within
days.
that 60 days. Thanks so much. Thank you, Mr. Chairman.
Any other questions? Senator, your motion?
Title sufficient, do pass.
The title sufficient, do pass is the motion. All in favor? Aye. Opposed? That bill will be carried forward. Thank you. Next, we have House Bill 970, Medicaid, extend the repealer date. And that's all the bill does is it extends the repealer on our tech bill to 2028. That's an explanation. I'll yield for questions. Seeing none, title sufficient, do pass is the motion. All in favor?
Aye.
Aye. Opposed? That will be carried forward. Senator Wiggins is not here to present his bill. We will have at least one more meeting before the 5th. So we'll take it up at that time. So Senator, you have a motion? Thank you. President report. Thank you.